All right, we're going to look over Chapter 6 pertaining to terminology related to the ear. The ear is an organ that's used for the sense of hearing. It's divided into three regions: the outer or external, the middle ear, and the inner or internal ear. When we look at the external ear, it's made up of what we call the auricle or the pinna, and the external acoustic meatus, external auditory meatus, the canal. The auricle directs sound waves, and the external acoustic meatus is the passageway inward toward the tympanic membrane, which is the boundary between the external and the middle ear. When we look at cerumen, it's the waxy substance secreted by glands throughout the external canal, so ear wax. The middle ear consists of the eustachian tube, the auditory tube, that provides a passageway to the throat, allowing air to pass to and from the outside of the body. Sound waves reach the tympanic membrane or the eardrum in the middle ear, which is important to maintain equal air pressure there. The eardrum, the tympanic membrane, receives sound collected in the external auditory canal and amplifies it through the middle ear. There's three little bones called the malleus, incus, and stapes. Vibrations are transmitted to the oval window, which stimulates the auditory fluids in the internal canal. Also in the middle ear, the auditory tube, also known as the eustachian tube, will connect the throat to maintain that equal air pressure. The oval window is a membrane that covers the opening between the middle ear and the inner ear. The internal or inner ear receives sound vibrations passed from the oval window to the cochlea. And the cochlea is a coiled tubular structure that contains the organ of Corti. Perilymph is a fluid that fills the bony labyrinth of the ear. Endolymph is fluid within the cochlear duct of the inner ear. The organ of Corti contains receptors that receive vibrations and generate nerve impulses for hearing, and the vestibule is a middle part of the inner ear that contains the utricle and the saccule. The utricle is larger of the two sacs within the vestibule in the inner ear, and the saccule is the smaller of the two sacs. Semicircular canals, there's the ear canals. There's three canals within the inner ear that contain specialized receptors that generate nerve impulses with body movement. So this kind of gives you you see the auricle, so the outside of the ear, and looking at the external auditory canal. You can see those bones, the malleus, incus, and the stapes, the ossicle bones. The cochlea, which often is referred to as the Snell-like apparatus. Facial nerve, so a lot of times you'll have nerve pain within an earache. Acousto or audio is hearing, so pertaining to hearing, or audiometry is the measurement of hearing. Aero is aerogas, so aeroitis, inflammation. Auri, oto, are both ear, so auricle is referring to the ear, pertaining to the ear, versus otology is the study of the ear. The cerumeno is wax, so eurumenosis is condition of wax buildup. Salpingo is the eustachian tube, and it can also mean uterine tube. So here it's pretty much tube. Salpingoscope would be an instrument used to look into the eustachian tube. Tympano and myringo are both eardrum, tympanic myringotomy, so incision into. Acousis refers to hearing condition, so presbyacousis. Remember, presby meaning age or old age, so hearing loss or hearing condition related to age. Some of the symptomatic terms that we see would be otalgia, so remember algia or dynia is pain, so an earache, so otalgia, odonia, or otodynia would both refer to an earache. Otorrhagia, rhagia meaning drainage, so bleeding from the ear. And then otorrhea was purulent drainage from the ear. Often all three of those seen, sometimes with earache. Tinnitus is a ringing or buzzing in the ear. And vertigo is a dizziness, or referred to as a turning around. Some diagnostic or anatomic parts. When we look at otitis externa, that refers to inflammation of the external acoustic meatus. Cerumen impaction would be waxy buildup that's impacted, often seen in elderly people. Some conditions we see of the middle ear would be myringitis, which is inflammation of the eardrum, often called tympanitis, which is right below it. And then otitis media is inflammation of the middle ear. Aortitis media is inflammation of the middle ear from changes in atmospheric pressure. But often when you travel or go to the mountains or on an airplane, you'll feel that. Eustachian obstruction, blockage of the auditory tube, usually resulting from infection like otitis media. Osteosclerosis is hardening of that bony tissue in the ear. Some ear things we see, acoustic neuroma would be a benign, but it can be life-threatening tumor of the vestibular division of that nerve that causes vertigo, tinnitus, and hearing loss. Labyrinthitis is inflammation of the internal ear, the labyrinth, usually also accompanied with vertigo and a loss of hearing or deafness. Meniere's disease is a disorder of the inner ear resulting from excessive buildup of endolymph, causing episodes of vertigo, tinnitus, nausea, vomiting, and hearing loss. It could be one or both ears, and then the attacks kind of are variant between people as far as the frequency and intensity, so it's different for everybody. Some general terms, deafness would be partial or complete hearing loss. That shows a normal tympanic membrane. That's what it should look like, intact. Audiometry. So this would be where we are measuring the hearing. So a process of measuring auditory acuity test would be physical assessment of hearing, differentiating between conductive and sensorineural hearing loss. So try to figure out how that person's vision is impaired. So they can use a tuning fork, which is a two-pronged fork-like instrument that vibrates when struck. And you can use this to test hearing over the bony prominence or bone conduction. They're used two types. It's like a Weber test and a Rhine test. So they kind of hit it. They get something that vibrates. They can put it on your forehead or behind your ear. And then you kind of say when you feel it or if you don't, and then when it stops. The brainstem auditory evoked potential, BAEP, is an electrodiagnostic testing that uses computerized equipment to measure involuntary responses to sound within the auditory nervous system, commonly used in newborns, often referred to as the Baird test. The Baird test is the brainstem auditory evoked response. It's a test, again, it's a test that's used a lot in newborns to see or measure hearing. Otoscopy, this would be where you're going to use an otoscope, and it's looking into the ear with a scope. You can see, should be able to see if the tympanic membrane is intact. Pneumatic otoscopy, this would be a scope that gives you observation of the tympanic membrane as air is released into the external acoustic meatus. Immobility indicates the presence of an air diffusion, so like fluid buildup, and it's usually due to otitis media, an infection. Tympanometry would be the measurement of the compliance and mobility of the tympanic membrane and the ossicles of the middle ear by monitoring the response to different types of external airflow pressures. There's the tuning fork, so it's showing the the Weber, so they're going to vibrate it, put it on the forehead, and then B is the Rhine test, where they can put it either behind the ear or next to the ear. And then this is an otoscopic exam, so looking into the ear. Sometimes there's a cone on there at the end, and then they can actually put something through there to either like remove wax or a foreign object. The pneumatic otoscopy, so you can see here, they're going to look for the tympanic membrane response as air is released into there. And audiometry, this person would respond to sounds. So you can see the person holding up their finger if they hear a sound. And then this is the BAB or Bair test that's used usually with newborns. Then we have operative terms, so microsurgery, so micro meaning small, the surgery of a microscope used on the delicate tissue. Myringotomy, this would be incision into the eardrum, most often for insertion of like an ear tube or canal to open up that ear canal. Otoplasty would be repair of the external ear. You see this a lot with fights or a bite, maybe a dog bite. Stapedectomy. Stapedectomy is excision of the stapes to correct otosclerosis. And tympanoplasty would be to reconstruct or repair the tympanic membrane rupture or the bones. Tympanostomy, tube placement here. You can see that tube in there. So it's kind of going to keep the ear canal open. It's a cochlear implant. It's going to help transmit. So it's an external speech processor that captures sound and converts it into digital signals. It sends a digital signal to an internal implant. So you can see here what's on the inside internally and then on the outside. The internal implant converts the signal into an energy, and then it's going to send it to an electrode that's inside the cochlea. The electrodes stimulate a hearing nerve bypassing the damaged hair cells, and the brain perceives the signals to hear the sound. And these are getting more advanced and advanced. So some of them are actually internal, and then the external piece is getting smaller and smaller, and it's like a magnet. Therapeutic terms, auditory prosthesis. This would be external hearing device, so a hearing aid or a cochlear implant. Ear lavage would be to irrigate out that ear canal, remove usually excessive buildup of wax, the cerumen. And then ear installation is where you introduce a medication solution into the external ear. And again, it's going to be by drops, which that abbreviation is GTT. Antibiotic is a drug that's going to stop or destroy microorganisms that are usually bacterial. Antihistamine is going to block the effects of histamine, so it helps bring down inflammation and swelling. As well as an anti-inflammatory, it's going to bring down inflammation. A decongestant, that's going to reduce congestion and swelling of the membrane, so it helps in the nose and the auditory tube. And I think that's it for the ear.